As the demands on our frontline workers continue to intensify, the need for mental health support becomes more critical than ever. Welcome to Normalize the Conversation. I'm your host, Francesca Regeter, and today I'm joined by Rawan Hamadeh, a dedicated program officer at Project Hope, leading their mental health programs. Join us as we discuss why Project Hope is on a mission to bring mental health education to our healthcare heroes, providing insights into Project Hope's efforts and highlighting the importance of equipping healthcare professionals with the tools to navigate the unique challenges they face.
Thank you so much for joining me today. I am really excited for our conversation where we're going to break down mental health in the healthcare industry and provide some information on Project Hope and the amazing trainings that you are conducting. But before we jump into that, I want to check in with you. How are you really?
Thank you so much, first of all, for the opportunity to talk about mental health. Uh, I feel grateful and I feel happy to be able to have this opportunity to raise awareness about mental health and to be in a safe place right now. So my name is Rawan Hamadeh. I'm a program officer with an organization called Project Hope. We're a global health nonprofit organization based in DC, but we have activities and offices all around the globe. We also do emergency response activities. So our work is five main areas, which are disasters and health crisis, or as emergency response, pandemic preparedness and response, specifically after COVID-19, infectious and non-communicable diseases, maternal, neonatal, and child health, and health policy. Our main mission is placing the power in the hands of healthcare workers to save lives across the globe, and thus the focus on the mental health of our hero healthcare workers.
It is absolutely amazing the work that you all are doing. I mean, especially within the healthcare industry with that pandemic. It's been a lot. They were at the front lines of everything, and there wasn't a lot of room for taking a break, taking time to take care of yourself. And the impact on mental health, I could not even imagine, which is why I'm really excited to have this conversation because I don't think a lot of people necessarily understand what it was like for a healthcare worker to be on the front lines during that, all the fear that came with that, the pressure, the workload.
Definitely. And also, it's affecting everyone because healthcare workers, they are the caregivers, they are taking care of us. So, if we really do not address their needs, then who will be taking care of everybody else? So, I'd like to start by talking about mental health in general, just to take this opportunity to raise awareness about this specific topic. So, mental health conditions are very common, like even more common than we know worldwide and in the US. So, in terms of stats, it's around 20% of the world's children and adolescents are living with mental health conditions. And suicide is one of the leading causes of death among 15 to 29 years old. In the US, for example, 1 in 5 adults is living with mental health condition. That's around like 47 million Americans. So it's very common. The conditions are very common, but there's also treatments available and they are effective. So just like physical health, also, the earlier you seek help, the earlier you start your treatment, the better prognosis you have. So actually, our overall health is dependent on our mental health. So it's really important to take care of ourselves, take care of our mental being, to really talk about it and prioritize and destigmatize the conversation about mental health, and to also be more aware about what are the possible preventative measures and activities that can be done to prevent mental health conditions, and also to seek professional support whenever is needed and not to delay it or not prioritize mental well-being because it actually affects our physical health as well. As you mentioned, the COVID pandemic was really a collective experience for among everyone, and it targeted healthcare workers specifically. At Project Hope, we say that there was a silver lining of COVID-19 because after the pandemic, it was really like the light was shed on the health workforce. And we're focusing now on the need of those groups, of the need of healthcare workers, and how we can take care of their mental well-being specifically. In 2022, the US Surgeon General published an advisory addressing specifically the burnout levels of our healthcare workers and the impact of stress on their well-being, on the workforce shortage that we're expecting and that we're anticipating a huge shortage in physicians and in nurses, and the numbers are really crazy. And they're even like it keeps getting worse if we do not address this issue. We do not address their burnout and their mental well-being. Like this issue is not gonna resolve by itself. And again, its impact on the overall health system, which is the overall population. So, whether responding to disasters or to the COVID-19 pandemic, nurses and physicians are already facing a lot of stress within their workload. Like they work really long hours. They are in direct contact with patients, with death, with really stressful situations on a daily basis. So they are already at a higher risk of developing burnout, and of being continuously exposed to this level of stress definitely leads to a higher risk of the development of mental health conditions. So a lot of studies have been developed, and a lot of surveys were administered during the pandemic and after. And the numbers are really high. Like 93% of healthcare workers reported being stressed out and stretched too thin. 86% reported symptoms of anxiety. More than 75% reported frustration, exhaustion, they're overwhelmed, they're burnt out. Yet, like only 45% of nurses reported that they might have some level of emotional support, and 13% of healthcare workers actually received behavioral health services or mental health support. In the US specifically, CDC surveys also showed numbers related to the mental health condition of healthcare workers, where 22% of US health workers experienced moderate depression, anxiety, and post-traumatic stress disorder. Around 69% of physicians reported experiencing depression, and 13% had thoughts of suicide. So the numbers are really reflective of the situation of healthcare workers, and like highlights the importance of targeting and addressing their mental health needs, and actually investing in initiatives that addresses their mental well-being. It's not also only affecting the health, which is like it's a human right and it should be a priority of everyone, but it's also costly. Like it's estimated that more than $1 trillion are lost each year due to depression and anxiety. And from the other side, less than 2% of the government's health expenditure goes to mental health. So there's also discrepancies in the numbers, and like just imagine how much like and $1 trillion can be done in mental health initiatives instead of like losing them to depression and anxiety.
I really want to emphasize something you said. So when you were reading the stats, about 90% or 93%, I believe you said, were facing that kind of overwhelmed, stretched too thin, too much on their plate, and then 45% had some form of emotional support. So less than half of them had a little bit of emotional support, possibly, and only 13% actually received services. That is so telling on the lack of support that's available, the lack of awareness, the stigma, kind of like you said in the beginning, was how if we continue to have this stigma, people aren't going to know what resources are available because people aren't talking about it, right? If there's this stigma, people are afraid to reach out for help, even if they do know what resources are available. So seeing these numbers really puts it into perspective on why we need more conversation, more awareness, and more training and more work like Project Hope.
And also to add to this, that healthcare workers, like they're heroes, especially like during COVID-19, and they see themselves as caregivers. So it's even harder for them to seek care because like I know I can do it. Like, I don't need anyone to take care of me. Like, I can take care of myself and everyone who is around me. So they do have this barrier also to seeking help because they don't want to feel like, oh, now I cannot take care of anyone else. Although, like, this is not true. And if you don't take care of yourself, then you won't be able to take care of the people who are around you. And there are resources, and we're trying to build those initiatives and to build sustainable initiatives to support the mental health of healthcare workers. So what we've been doing in Project Hope for the past like 3 years since the pandemic started is delivering mental health and resilience training sessions to healthcare workers from different levels of care. So anyone can attend the training, not necessarily to have like a specific background or technical background, because it was actually developed to be as like user friendly as possible, and anyone can really attend the training. And it's also a training of trainer model. So whenever you attend this training, you either attend it as like a knowledge session, or you attend it as a possibility to be a trainer. So you can train your colleagues in whatever organization or health institution you work with. So we decided to take this as a TOT just because, as you mentioned, it helps with stigma. So imagine like your supervisor at work coming and telling you, okay, we're gonna do this training, we're gonna train our colleagues, we're gonna start talking about mental health, we're gonna prioritize mental health, we're gonna have this safe space where mental health challenges and like the stress and the burnout and everything that you're going through is something normal to discuss. It's something essential to discuss so we can build our resilience, so we can support each other, and so we can like move our productivity forward and continue the work that we're doing. So it's both like the knowledge and the technical content of this training, and it's also building this culture at the workplace where mental health is important, where mental health is something we talk about, we discuss, and we prioritize.
What comes
So
up for me with that, sorry, but what I love about it too is that it's not just let's have a conversation. Here are like tangible tools and things you can do. Here's how you can seek help. It's not just, oh, we want to talk about it in the workplace. It's we're talking about it because we care about you and here are things you can do. And I think that really helps alleviate some of that stigma and helps make people feel okay, it's not just they're doing this seminar that they're required to do. They're actually coming in here and giving us tools and giving us permission to be human, to need support and know that it's okay to talk about it in the workplace and to reach out for those tools when needed.
yeah, definitely. And I always like to share this comment that we received in multiple of our trainings, to be honest. Healthcare workers reach out to us and say, like, we're used to attending trainings, like this is part of our continuous education. Like we're always like used to this form of activities within our workplace. But usually it's always patient centered, and this is the first time that we attend something that is targeting us, that is addressing our needs, our challenges, where we can share what we're going through and not just like getting knowledge to implement within our work. No, it's something that we can take home with us. It's something that will help us in our everyday life. And I love this testimonial from participants. It's why we do what we do. So I can go through like a bit of content, like, and what those training sessions address during. It's a full day training if it's a training of trainer, so it takes like 8 hours to go through everything. So we talk a lot about the etymology of stress, like the definition of stress and trauma. What do we mean by when we say, oh, I'm stressed, or like I'm dealing with a lot? And we discuss what is resilience and how fluid it is, and how everyone can have their own like definition of resilience in the framework that it represents. We discuss also the impact of disasters, or specifically COVID-19, if it's the disaster that we're talking about, on the psychological well-being of frontline healthcare workers. How do we react to stressful situations, whether cognitively, emotionally, behaviorally, physically, and even spiritually? There's a big part about loss and grief. Healthcare workers, especially during the pandemic, they lost family members, they lost patients, they lost colleagues. So they had like really cumulative grief and loss of a lot of people around them. So we talk a lot about loss and grief. We provide them, as you mentioned, with stress management tools, with tools on how you support yourself, how you support each others as colleagues, how to do check-ins, how to do debriefs, how to embed those in your daily life, like even taking a water break every now and then, like emphasizing this and how important this is for your well-being, and to keep on doing the work. We talk about the stress continuum, because stress is not like one rigid concept. It's actually a continuum where you can be like in the orange phase of stress, where you can still manage, you can still be productive, but you have a lot on your mind, and you can shift to like the red part of the stress continuum, where you're actually freezing and you have zero productivity, zero motivation, and you cannot do, and this is affecting your behavior, your emotion, your cognition, and everything. We talk a lot about what are the common trauma reactions. And this is to identify in yourself and to also identify within your colleagues, because like some red flags can be identified within your colleagues, and you might say, okay, like this person might need a bit more support, might need for us to help him or to support him get the help that they need. So it's for us and for our colleagues. A lot of healthy versus unhealthy coping strategies, and how we build our own healthy coping strategies based on our own lifestyle. What works for you might not work for me, so it's very individual. So we take on this exercise where we identify what works for us, what are our healthy coping strategies, and focusing on them instead of the unhealthy coping strategies. And again, because it's stigmatized, and like seeking help is still not a behavior like that is normal. So we emphasize like, when is it time to seek help? When it's like time to seek emotional support from family members versus when to really seek professional help? And what are the obstacles of getting those help? Sometimes, like in other countries, in middle to low income countries, it's very expensive. Like people do not have high quality accessible mental health services. Here, maybe sometimes it's covered by insurance and sometimes it's not. So we talk about all of those and the availability of like employee assistance programs. We try to adapt the curriculum based on the people that are attending, and to see what are the available resources for them, or even get them to do the exercise of identifying like the hotlines in the states, and like who is delivering those services. And we provide this to everyone, so they know what are the available services, and we push them and encourage them that if you think you need to reach out, please feel free to do that, and it's fine, and it's something good and not stigmatized. And the last part of this training, we talk about the development of resilience and wellness program. Again, it's same concept discussed earlier. It's to build this culture at the workplace where mental health is something we prioritize, we care about, and we actually implement initiatives and activities to build the resilience of our healthcare workers and to support their mental well-being. So far, we delivered this training in more than 43 different countries, and we've reached more than 100,000 healthcare workers all across the globe since the pandemic, since 2020.
That's amazing.
And in the US specifically, I think we've reached a bit more than 400 healthcare workers from multiple states. I think we're in 10 different states. And we're working with other implementing partners to support the identification of healthcare workers and to adapt the training curriculum and to deliver those training sessions. So we've been doing it for a while now, and we're really happy with the turnover, how the sessions are taking place. To be honest, even the online, the in-person training sessions are super interactive, and we really want everyone to talk, to share, and to open up. And it happens sometimes the day ends and people are still wanting to share and wanting to talk with our facilitators. And even the online training sessions we try, online is a bit less interactive, but we try to push as much as possible for participants to share and to feel that they're involved with it. And we've been lucky to have participants who feel who link, I think, who connects with this topic, because it's very personal. Mental health is something very individual. It touches you personally, and everyone has a story. So having the safe space, even if you take this hour or hour and a half from your day and just focus on that. Sometimes healthcare workers, they already know most of those stuffs, but putting them into perspective and focusing on them and letting them connect all the dots, it helps them a lot.
There's so much value in these trainings. I mean, right off the bat, one of the first things you said that I loved was resiliency and how we all have our own definitions, because I think growing up, something we're taught is that resiliency is you fall down, you get right back up. And when we can't get right back up, we're like, something's wrong with me, and we're internalizing it. And I am generalizing this to everybody, and I probably shouldn't be, but that is just from my experience and from my loved one's experience. It was very, you fall down, you get right back up. And when it took us a little bit, or when we needed support, when we needed to reach out for help, we kind of felt like, oh, then we're not being resilient. So I love talking about what resiliency is and how it looks different for everyone, because I think just having that lack of needing to internalize and say that I'm the problem because I can't bounce back right away by myself really takes away some of the shame, so that people want to reach out for help, that this is okay, that I can still be resilient while having support. Another thing you talked about was that stress and how the different levels, like the orange zone. I love that because when it comes to stress, we're often taught stress is bad, but we're also taught that operating at high levels of stress is normal, what we should be doing. And there's a difference, right, between that productive level of high stress that's challenging you, that's helping you grow, and that's making it hard for you to function, that's hurting you, that it's physically and mentally draining everything out of your body. There's a difference. And having the tools that you need, the adaptive coping skills, like you said, this is all essential. So I'm just so appreciative of how comprehensive this training is, because it really breaks it down from that beginning of, you're still resilient, even reaching out for help. Here's how you can reach out for help. Here's things you can do. Taking that water break, right? Just a water break during the day. Take a moment, take a deep breath, to debrief with your
Deep
coworkers, your
breathing.
colleagues, your friends, all these small things that you can do that you might not even realize you can do to support your mental health. And that's incredible.
Yes, exactly. And especially that there's a lot of evidence-based small tech. It's not small, they do work, but it's evidence-based. So just like the breathing, the 4x4 box breathing technique, we do it a couple of times during the session just to highlight how important that is and how it doesn't take a lot of your time. It doesn't take a lot of your energy. But if you integrate it in your day-to-day activity or whenever you feel that you're overwhelmed, then it makes a difference. And something I heard also during the training sessions, that made sense to me also, like, and validated what we're doing is one of the nurses said, like, okay, especially when we talk about like the common stress reactions and how do we deal with that from the physical aspect. She said, like, I'm a nurse, like I've been having like this stomach ache for a while, and like I was 100% focused on like the pathological part of it, the physical part of like what's wrong with me, and I'm doing tests and like there's nothing wrong physiologically with me. And then now like linking it like, okay, I've been going through a lot for the past couple of months, so most probably this is all because of stress. So just like putting things into perspective, like laser focusing on those concepts that just passes by throughout your day is very important, and it will help you identify a lot of things that you're going through, and like you will feel calmer about it, like, oh, okay, it makes sense now. Let me see what I can do to fix it.
I love the focus on or that example with the physical symptoms because that is so common that we have maybe that stomach ache or that rapid heart rate or our chest is hurting, right? Maybe these numbness and tingling, all these things that are physical responses, but they could also be stemming from our mental health. So when you're getting all these tests run and nothing's happening, nothing's showing up, it's really important to recognize that your mental health plays such an important role in your physical health, and if we don't talk about it, people
Mhm.
don't know that that's something that could be
Yes,
impacting them, and then long term, having these bad stomach aches that are making you physically sick is not great for your body, and it can't feel well for you, so knowing that because of these trainings, people are able to actually see, "Hey, I've been actually struggling with my mental health. There's things I can do," and that will help me feel better, not just mentally, but physically, is so validating.
definitely. And especially with everything that we're going through, like after COVID, like the stress of, I don't know, inflation, all the global conflicts that are happening, like we're exposed whether directly or indirectly to all of that. And we will become like irritated, and will lose some level of like energy and motivation. Sometimes we don't know that all of this is affecting us, whether we're noticing it or not, whether directly or indirectly. So really having this set of like self-care techniques that we know works for us, and having to resort back to those techniques whenever we feel that we're not feeling well is very important, and it will save us a lot of physical symptoms, a lot of heartache and headache and stomach ache. So we really focus on that, and we really try to simplify it. Like, we don't want everyone to go to therapy, like, unless you need to, but there are so many simple things that we know that, okay, yeah, this is good, but we do not make time for it in our daily life or even during our weekends. Like staying connecting with others. I know from myself, like this is something that I'm trying New Year's resolution to stay connect with other people, because if I'm working at home for a couple of days, I tend to forget myself and I don't speak to people, and then I feel like I'm drained, and this is just because like I need to go say hi to my neighbor or something. So this is one example of like coping strategies or self-care techniques, like limiting exposure to social media, for example. Like this is something we're glued to our phone the entire day. So taking a break from social media, you have no idea how much like my stress level decreases whenever I say, okay, from now to like 1 hour, I don't wanna check the news. I don't wanna see what's going on. So sometimes I say like I'm being selfish, but I need this. I need to take care of myself, or else I wouldn't be able to function or go on. And like, who am I benefiting if I did that?
That's such a
So I really,
common
yeah.
sorry, I was gonna say it's such a common belief with self-care practices and taking care of ourselves is that it's selfish, and then we feel guilty for doing these small things, but like you said, if not feeling connected to people is draining you, making that time to talk to somebody, to have a conversation, to just be there and be present, to take time to take a deep breath, to get off social media, not answer all the DMs and like everyone's photos and comment or whatever people expect us to do on social media. Just taking these breaks to support our mental health might feel selfish in the beginning, but it's so incredibly important, because if we can't provide ourselves the love and support that we need, it's not fair. We deserve to have that support, to feel strong, to feel good physically and mentally.
Definitely, definitely. And it's also very important to be aware of what we're feeling. So not just like whatever, or like just get busy and go on through your day without really identifying how you're feeling. And I love this part of this training. We also have like the name your emotion wheel. I don't know if you've seen it. It's a really nice interactive like tool where there's like multiple emotions, and like it focuses on specific type of major emotions, and then it details more specific ones. So it's a nice also tool that we provide that will help us identify what are we feeling. And then usually when you identify what you're feeling, or you identify what this feeling is connected to, it's easier to deal with it and to understand it, to accept it, and then to move forward. So it's also one thing that I really like about this training. And again, it's very individual. It's not a one size fits all, and it's something that we provide for everyone, not for them to be able to have this awareness and to focus on, okay, then now I'm gonna decide what works for me so I can actually put it in practice.
It's so important for mental health that we are taking it in an individualized approach, because it's not a one size fits all. What works for me and what works for you can be completely different. And that's okay. Just because meditation works for someone doesn't mean that has to
Yes,
work for you. Just because someone likes to go for a run doesn't mean you need to start running marathons if that's not what you want to do. If you do,
definitely.
enjoy that. I don't like to run, so it doesn't sound fun to me. But that's the thing, is it's different for
Yes.
everyone, and that's okay.
Yep.
And I think that is just so incredibly important that we are continuing with these individualized approach, and identifying your feelings is really the start of it. When you're able to identify, why am I reacting out of anger? Am I really angry and mad at something that happened? Or am I feeling frustrated and overwhelmed? Maybe there's just too much on my plate and I haven't made time to cope, and now I'm expressing it as anger. Am I really feeling sad and depressed? Am I feeling isolated? And
Mm-hmm.
by identifying those different emotions, maybe
Yes.
a different coping skill or self care strategy is going to work for you. Because when I'm feeling frustrated and overwhelmed, it's not the same coping skills when I'm feeling mad and angry. When I'm mad and angry, I might want to scream into a pillow or go hit a tennis ball. But if I'm feeling frustrated and overwhelmed, I might want to take some time to do some deep breathing, maybe do some organizing of my schedule, make some better time management for myself, and break down what I reasonably can and can't do. If I'm feeling isolated, I want to talk with my friends and get connected. But if I'm feeling depressed, maybe I want to work on some coping skills or reach out to a therapist for some help. So by identifying how you're feeling, it really can impact, the basis of what you do to support yourself.
Definitely. And this is also part of the project that we do, is the contextualization and the adaptation of the training curriculum. So whenever we have an identified group of uh, healthcare workers that we want to train, we try to collect a bit of data before we do the training about their context, the state where they work, the country where they work, that they have like any recent crisis that they had to deal with. So we try to do a bit of research and a bit of adaptation and contextualization to the content before we go and deliver the training. Even if it's like as simple as like adding specific songs that are related to the country, or add specific layout, or talk about a specific component of their lifestyle or of the crisis that they went through. So this is a big part of this project as well, the adaptation process, and especially that we implemented it internationally as well in 43 different countries. So we had to not only translate it, but to culturally appropriate all of the content to our target population. And we did that in collaboration with local mental health experts in the countries where we implemented it. And before we delivered it, again, it's not a one size fits all. And especially in mental health, like you cannot prepare and develop a training curriculum based on like healthcare workers in New York City and go ahead and deliver it in Nepal, for example. They have different exposure, different coping mechanism, different self-care techniques that they use, even different spirituality level or different activities that they do. So the contextualization part is a big component and a very important component of this project as well.
That just shows how much Project Hope cares, is that it's not just about creating a training and delivering it. It's about meeting people where they are and understanding the context that they're coming from and how we can actually support you and give you tools that work for you. Because like you said, New York City and Nepal, that's completely different. And it's not a one size fits all. I don't know like how much we can emphasize that. It's not a one size fits all. And when you are actively making a point to translate into different languages, to adapt it to different cultures, it just really shows how genuine the mission of Project Hope is.
And you need this also to connect with the people. You would never be able to establish this trust and this connection with the participants of this training without like telling them that this is for you, this is targeting your needs, and this is an initiative with the objective of supporting you. It has nothing to do with anything else. So this was very needed, and this, I think this is the only way you can do mental health initiatives, to be honest. You know, I don't think there's any other way you can do it. Like adaptation and contextualization is a key component of any mental health activity that you can do anywhere.
I agree. And with these standardized approaches that we're so used to, it's very difficult. And I think that we see that throughout the mental health and behavioral health is that because when it comes to our physical health, it does tend to be this medication works for this treatment works for this. And it is, I'm not saying it's easy because I cannot imagine being a doctor and trying to figure any of it out. However, it's a little bit more straightforward than mental health because the symptoms not only appear differently in everyone, but also what medication works for someone won't work for someone else. What therapy modality works for someone might not work for someone else. So it really is a completely customized approach, and everything that has to do with mental health, we need to switch toward focusing on the individual and meeting them in their context where they are and supporting them with what they need instead of going on this standardized one size fits all. If this works for you, it's going to work for everyone because realistically, it's not going to provide as much value as it should.
Yes, definitely.
I am so grateful for you, for Project Hope, for all this amazing work. As we are wrapping up, how can people learn more about Project Hope, learn more about these trainings, see these trainings, volunteer, donate, get involved?
Yes, so we have our website, www.projecthope.org. We have everything that we do on the websites, how you can support in terms of volunteering, donations. We also have it on our website. We also have an online recording of one of the training sessions, the mental health and resilience training sessions, that you can register and attend. You will have access to this recording and you can attend it. It's also there on the website. And also, I would encourage to reach out to us, send us an email if the organization is interested to provide this training to their staff.
Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation and visit our website inspiringmygeneration.org to learn more about our work and how you can make a difference.